Good day, viewers, and welcome to the command center of the COVID-19 response. We are also live on the National Television Network NTN studio. This program is carried live by other television stations and other social media platforms. I am Philip Sidney, the Communications Officer in the Department of Agriculture, Fisheries, Natural Resources, and Cooperatives. Like other departments and ministries who have gone before us and have responded to their activities as per COVID-19, who have affected their activities, the Ministry of Agriculture also is being affected. We have had responses by the Minister with responsibility for agriculture, fisheries, physical planning, natural resources, and cooperatives, the Honorable Ezekiel Joseph. As far as the farmers are concerned and the fishers are concerned. Today with me at the head table, to my immediate right, is Dr. Sharmaine Melville-Edwin, who is the officer in charge of the Veterinary and Livestock Services Division in the Department of Agriculture. To my far right is Mr. Oni Pierre, who is the environmental officer in the Department of Health. And of course, you can understand the collaborative effort here. I want to say to us that this virus is deadly, and we pray to God that we are going to beat this virus. We will, at the end of the day, God will assist us to win this war. I would ask Dr. Sharmaine Melville-Edwin to give us an idea of her division's responsibility, as it were, and also she will give us some idea of what the activities are in that unit. Dr. Melville.
Good morning, Sydney. Thanks for having us. It's a pleasure to be here and to share with the population, to share with St. Lucians what the Department of Agriculture is doing in its response to COVID-19. The Veterinary and Livestock Services Division is responsible for the development of the livestock sector in particular. And so in that vein, we provide livestock farmers with technical assistance, improve genetic stock to facilitate the bloodlines, to improve breeding stock on island. And also we monitor the levels, production levels. We collect production data. We do our routine farm visits to ensure that to maintain good animal health, to minimize the spread of diseases, and that sort of thing. You can understand, though, that in light of this pandemic and in light of the measures instituted by our health authorities and the government in particular, we have suspended some of these activities because we also have to protect our staff and our clients. We have suspended some of these activities as we wait guidance from the minister, as we are still in the partial shutdown mode. But as it pertains to the global pandemic, that had some serious detrimental effects, specifically on livestock farmers, not just in St. Lucia, but globally. And we can get into that a little later. So our farmers have not been spared the impact of COVID-19. The economic impact is severe, especially with our swine farmers. So you have swine, poultry farmers who have lost markets. Everybody, the tourism sector has been badly hit by the pandemic, as we all aware. We're all aware of the job losses. We're all aware of the closure of hotels, and so this has had a ripple effect on other sectors, particularly agriculture. We've witnessed how farmers had nowhere to dispose of the crops. So we have a similar problem with livestock farmers who now have lost that market access through the hotels. So the ministry is continuing to work to assist farmers as much as we can. In this time of food security is high on the agenda. as you can imagine, globally as well, international bodies are stressing the fact that veterinary professionals, public health professionals are critical and essential even in responding to COVID-19, because you still have to maintain a level of food security, but also a level of food safety.
Correct.
Yes, we want to ensure that there is food, but they have to ensure that the food is wholesome and safe to eat. If not, we'll have another crisis on our hand, compounded. So veterinary professionals, livestock professionals and so on are very important in ensuring that we have healthy food. So the veterinary division also works to ensure and to keep our borders safe from diseases, from foreign diseases and so on. But with the borders being closed, we have also cut back on that, on the level of quarantine services that are offered. You can imagine borders are closed, there's not much coming in. But we are still on the front line. We still have services open, courier services open. We are still on the front line offering these inspection services to ensure that what comes in, to protect our borders from foreign diseases. These risks are still present, okay, because we are still importing, we are still trading. Also, as regards to public health specifically and safeguarding the foods that we eat, as it pertains to meat products, we are still, of course, the country has to continue eating, and so meat inspections continue. Mr. Pierre will provide more information on that as well. We are working jointly in terms of ensuring that animals that are destined for slaughter are fit for slaughter, and that the products that are what is produced from that are safe to eat. So inspections are still ongoing. Our officers are still on the front line, providing these essential services, providing these inspections, and I would like to commend them in that regard. I would like to take the opportunity to commend our public health officers who are still on the front line, carrying out inspections and ensuring that we have safe meats and animal products.
Great. Okay, thank you, Dr. Melville. And of course, you can understand why we have this collaboration with the Department of Health, because you have the ante-mortem and then you have the post-mortem of those animals. So, Oni, could you tell us exactly what, give the public an idea of your department's involvement as far as that is concerned?
May I say good morning to the listening public, and I want to say thanks to the Department of Agriculture for inviting us here, inviting myself here this morning to give a preamble as to how the Ministry of Health is in fact responding to this crisis. Food safety, as you know, is of paramount importance, and we have collaborated very well with the Ministry of Agriculture over the years in ensuring food safety. Dr. Melville has elaborated as well on food security issues, but notwithstanding, I also want to say, notwithstanding the fact that we have two ministries here, or two departments represented here, there are a number of stakeholders as well that are integral in terms of the process when it comes to meat. I must say as well, the Department of Environment, the Department of Health and the Environmental Health Division, their role is very broad in the response to COVID-19. But for our discussion here, I would focus more on the issue that is at hand, which is food safety. And as we speak of meat, you would see that the Environmental Health Division, we have developed guidelines with our stakeholders, and that those guidelines will guide as to how the butchers do business. We have a key role under the Public Health Act and under the slaughterhouse regulation. That slaughterhouse regulation governs how the butchers and persons that intend to slaughter slaughterhouses, how they should do business, and to ensure food safety, to ensure that the foods that they are putting on the market are in fact safe for human consumption. As Dr. Melville has said, if that is not done, it therefore means we can have another crisis, which is food safety outbreaks. So in the midst of COVID, the Environmental Health Division, we are balancing food safety has to be balanced. We need to ensure as well within food safety there is no food security if there is not food safety.
Correct.
Because the foods that will be produced, if it is not done on a safe environment, if it's not inspected, if it is not done properly before it's placed on the market, it can very well be condemned again, and therefore, which is lost, that food becoming lost to the wider market. So, with that said, I also want to mention the fact that we now have integrated in those guidelines measures that the Department of Health has under the Quarantine Act to further guide the operations of the butchers. Normally, and that is what we are going to discuss here as well, normally you will have the slaughterhouse regulation, which is a part, but with the outbreak of this COVID-19 disease, we now have to integrate measures to ensure that whilst we try to ensure food safety and food security within the nation, we in fact are not causing another public health crisis by having measures in place to ensure that we have proper social distancing and those kind of things in place. So we will discuss it a little further, but I just want to highlight the pieces of regulation that will govern our discussion here, and the Public Health Act, the Slaughterhouse Regulation, and the Quarantine Act.
Well said, Ronnie. But can we just go back a bit and just give our Creole listeners a little bit of Creole and just what you said there, Ronnie?
Yes. Sama kadi pour moun ki pati tan, ne mwen se Eni Pierre ek mwen la ka diskusi pi Departement Agricole, Mrs. Sydney ek Dr. Melville. Nou ka gade guideline that ministre jamais mis en place. Papa konon yon, non jamais mis ces guidelines ça là en place tout département gouvernement qui n'y a weg ka gouverne ça nous ka dit les moun ka tuer viande boucher et bien personne qui veut tuer viande anti abattoir yo ka nous ka doubler à ce programme ça là qui manière qui ça on est pour faire pas nous ka garder weg ça là pas moi savent là un chat boucher qui ka tuer viande pour te ka faire une manière mais non jamais été COVID-19 n'ont jamais été plus guideline en place et c'est by ça qu'ai aussi assuré that là ka tuer viande là ka vendre viande pour public là that ou pas ka mettre santé moun at risk ou pas ka mettre santé at risk en risque et c'est moun là qui ka aider là so nous ka regarder toutes ces bagailles ça là et nous ka quand si j'ai à développer nous ka aider plus à ce qui ça non en place pour assurer that là ka conduct business ka vendre viande nous ka aider qui manière ça fait ça et toute bagaille qui en règle là pour ça guide.
D'accord, monsieur. Oui, je bien content by Pepe anti direction à ce travail où on a fait à la ministre là. Dr. Melville, I'll go straight to you because I think there's a lot to discuss. As you are aware, the hotels are closed. Okay, the farmers we're selling the meats, of course, to the hotels and of course to the supermarkets and restaurants and stuff like that. So that has slowed down quite a lot. What do you have on ground in terms of have you carried a survey on ground to find out exactly how many animals that are out there to be slaughtered?
Well, as it pertains to, for example, poultry, the dynamics are a little different. You have birds on ground. Farmers are contracted by their processors, and so processors are presently harvesting birds because you cannot keep the birds on the ground for more than the period past the harvest time.
Correct.
What will happen is that you begin to have animal welfare issues. Animals will put on weight, you will have animals beginning to die. So processors are harvesting the birds and basically storing. So what you have now is a lot of storage of these of chicken happening right now.
Correct.
Because of the loss of markets. So at least we're able to store the chicken. Swine farmers, on the other hand, in the absence of an abattoir, are left with basically, we have our figures, we have our data, we have several thousand, quite a large number of fatteners, what we call fatteners, pigs that are ready for slaughter. You can understand that the Easter period is a time that you would typically have a high sales of meat, of pork, and that didn't happen this year because again of COVID-19. So we have these animals still on ground.
Wow. So what's going to happen to those animals?
So farmers would be left to continue feeding, and we're working to see how we can assist farmers, what we can do to assist them at this time. So the ministry is working hard to see how we can help the farmers destock, basically.
Okay, what's the situation with the eggs now?
Eggs, again, producers would have to, those who are able would have to store eggs as much as possible. Again, the thing is that the larger farmers were the ones who had that hotel market. The smaller farmers have their smaller markets, the communities, and so they're selling to the communities and supermarkets. So that is not so much affected. That is those who had that access at that market of the hotels are the ones that would be impacted.
Okay, thank you very much. Okay, thank you, viewers. We are due for our first break. Stay tuned.
COVID-19 is a new pandemic disease as declared by the World Health Organization. It is transmitted directly by respiratory droplets when an infected person coughs or sneezes, or indirectly through rubbing the face with contaminated hands. There is still no specific treatment or vaccine against COVID-19, and as such, the farming community should adhere to some special recommendations. Stock up on essentials such as animal feed, fertilizers, pesticides enough to last for about 30 days. Stock up on fuel and oils for farm equipment. Ensure that tools and vehicles are serviced to prevent breakdowns and to ensure that farming and food production remain steady. And protect yourself and your workers by ensuring you take all necessary precautions to remain healthy. More than ever before, your important role as gatekeepers of St. Lucia's nutritional health and food security should be taken seriously. When you exercise these precautions, you not only safeguard your health, but also continue to allow St. Lucians access to freshly grown fruits, vegetables, and other local crops. Remember, it is our responsibility to ensure our nation eats fresh, St. Lucia's best.
Welcome back to the program. We are here live in the studio of the National Television Network, NTN, and with me is Dr. Melville-Edwin, who is the officer in charge of the Vet and Livestock Services Division in the Department of Agriculture, and Uni Pierre, who is the environmental officer in the Ministry of Health. Dr. Melville, I'll still go back to you because I think we need to know what's happening to our food security. We need to know where we at and moving forward, what's going to happen. As far as imports are concerned, I don't know what's going on. Are you saying that the farmers, with the closure of the hotels and the supermarkets, moving forward, are you saying there will be a market for them locally? And is it the right time for us to consume, what we call eat fresh St. Lucia's best?
I like the fact that you mentioned eating fresh and promoting local, because at this point, St. Lucians, we really need to consume what is local. We have the potential to produce, and I want to encourage our local population to consume local, to buy local. COVID-19 is affecting international markets as well as locally. You have now many plants in the U.S., maybe I'm not sure how many people are aware that there's several large plants in the U.S. that have shut down, that have closed down for many issues, for many reasons. For example, because of staffing issues, you have you have outbreaks at these large plants. You can imagine workers in processing plants, shoulder to shoulder, as they process the meats, and even as they go out into the communities, they come back to the plants, and they're all in that environment. And we've had outbreaks of COVID-19 in these plants, and several plants have had to shut down. Some of the larger plants in the U.S., pork, you mentioned Tyson.
Beef, yes, beef.
Wow.
Beef
plants
as well.
Pork for sure has some of the bigger plants, Smithfield and so on, have shut down, have closed their doors, and so it's affecting the U.S. market. You may have heard recently that one of our importers was speaking, and I've spoken to a few of our importers, and they've indicated that the U.S., they're going to, some of the larger plants are going to stop producing chicken backs, which is something that St. Lucians love and is more accessible for many St. Lucians because, again, of the dynamics in the market. They're not going to cut the chicken in that way so that they will no longer be producing basically back because of the way they will be cutting. And again, because of all what is going on in the U.S. market, you have farmers who have had to depopulate because you have issues with transportation. Shipping lines and transportation lines have been hindered. So you're producing, but you have no way of getting it to the market. You have labor issues. So all of these things are affecting our international suppliers. And so I believe for us, hey, it may be maybe an opportunity for us to see how we can develop what we have locally. So I'm encouraging solutions, produce locally. We produce eggs, for example. We are self-sufficient in eggs. We do not import eggs. Eggs are a cheap form of protein, a good form of protein, and a cheap form of protein. So I'm encouraging our solutions to produce locally. We have our local chicken, our processors, local processors are storing chicken at this point in time. So there is much available on the market for us to consume locally.
Okay, let's move forward. The butchers, where with COVID-19 around, where are we now with them? What's happening? Are they still slaughtering? And if they are still slaughtering, what are the conditions for slaughtering? Anyone who can answer?
Yes, the butchers, the ministry has given the butchers the go-ahead to slaughter. However, they must do so within the public health regulations I mentioned earlier. And to facilitate that, we have also set guidelines. And those guidelines include some of the measures that we are seeing for COVID-19, for distancing, social distancing, the wearing of masks. But what I will do, I will just go to outline, and we will go into detail just to outline the guidelines, what is contained, what one who is destined to slaughter, maybe a butcher, a farmer, what they need to do. The first order of business, really, one needs to visit the environmental health division. Those persons need to have health certificates. Most of them would have already had it, most of our regular butchers. So though that would have been, we would have had difficulties with the shutdown, but they would have already had a health certificate. So we are asking for them to have at least what we call, even though not a full abattoir, but you have at least a slaughter slab. In that slaughter slab is provided running water. You have facilities for hand washing. You have a superstructure. You can easily manage your waste. All of those things needs to be in place and is guided within the same guidelines we have produced and within the regulations that I have mentioned. But there are a number of agencies which I mentioned earlier that are involved in butchering. Once that is in place, as I mentioned, the slaughterhouse aspect, and we'll go more into detail, they also need to involve the police, because the police department, they are the authority on issuing what is butcher's license or a permit to slaughter. What the Department of Health does in the Environmental Health Division is to issue the slaughterhouse license. So we will be looking at all the conditions necessary to ensure that you meet with the health certificates, that they have water, they have running water, and to ensure that they have all the things that I recently mentioned. So once that is in place, we get the butchers the permit from the police. That will be followed as well, and we will go into more detail. I'm just outlining. They also need to visit the veterinary division. And the reason for that is that before you can slaughter an animal, and Dr. Melville will elaborate more on it, you must have what is called an ante-mortem inspection for the animals to be slaughtered. And following that ante-mortem inspection, the veterinary division would issue a certificate. that this animal is fit to proceed to slaughter. And I will not go into those details.
Right,
Dr.
yeah,
Melville would
yes.
outline that. Once that is done, and that animal is in fact slaughtered, the Environmental Health Division, officers attached to that division, will conduct what is known as a post-mortem inspection of the slaughtered animals to ensure that the carcass of this animal, the meat, to make it simple, is fit for human consumption.
Okay.
So, and we'll elaborate a little. I'm just outlining.
Yes,
we will go more into what a post-mortem actually entails. So, we also have butchers who sell at the market. Facilities are provided at the market. So they will transport to the market. Once that meat gets to the market, there is again another inspection to ensure, because a product can pass that post-mortem inspection and be certified fit for human consumption, and then various conditions along the way can change.
Right.
And that can cause render that product unfit. So we have had reason or instances where we have passed meat and then to condemn it later. So we constantly check throughout the supply chain to ensure that the conditions are met and that the meat is in fact fit for human consumption. So transportation is important. And I want to go into just to highlight, with COVID-19, we mentioned the Quarantine Act and what the Department of Health under the authority of the CMO has put in place for a number of establishments that want to operate. The butchers are not exempt from those guidelines. So that's why the guidelines have been modified from what the butchers know, to ensure that they are doing, not only them while they are slaughtering, not only the butchers and the helpers, but as well as the customers that are coming, that to purchase meat, that enough is being done in terms of ensuring social distances. The markers are being placed, that they have hand washing facilities, that they provide adequate sanitizing agents to sanitize their hands, that they are in themselves wearing masks, that they are adequately and appropriately dressed. So we will be doing more monitoring to ensure, given this COVID situation that we are in terms of that disease, that we ensure that not only food safety, but we are ensuring that those things are in place to ensure that we are not creating a situation where the disease can continue to spread.
Correct. Very good. Very good. Okay, Dr. let's go back to the ante-mortem and your division's responsibility in ensuring. So, for example, if a butcher wants to purchase an animal, okay, right now we are zoned, okay, so he wants to go into VA4 to get a cattle or whatever the case may be. Well, how does that work? So give us your take on that.
So any person who wants to transport animals from the north, south and so on would need a transfer permit. That even prior to COVID, that was necessary, a transfer permit, because the particular, for example, we have our TBT issue in the south. So we would have had to get a transfer permit. The animal would be inspected, treated if necessary, and then you would be allowed to move the animal. Okay. All right, now what we're asking persons to do, if you need for some reason to go across the zones for farming purposes, you can contact us and we will work with NEMO to provide you. NEMO is able to provide you with some sort of pass, a letter that you can provide to the police at the border that you can use to go across the borders. Okay. But you can always contact us. We can assist the farmers. We've been assisting them in that regard. Okay. Now, about the ante-mortem at the butcher's site. As well now, as it relates to ante-mortem inspections, very, very, very important in the inspection, the whole inspection chain. So, as a veterinary division, our officers, we would inspect the animal prior to slaughter to ensure that the animal is healthy enough and fit for slaughter. This animal would also be tagged with an identification number, so that when the officers from environmental health come in to do the post-mortem inspection subsequently, they are aware that this animal has been inspected. Ante-mortem inspection entails, we look at a number of things. It's a physical examination.
Okay.
We do a visual. We look at how the animal walks, because you can tell how is the gait. Does it have a proper gait? Is it breathing properly? Are you noticing abnormalities in the way it breathes, in the way the body moves? Is it recumbent? Is the animal standing? That is important.
Yes.
So we look at these physical deformities, we look at all of these things, and if the animal is fit, we would issue that individual with an ante-mortem certificate that he then has to present to the public health inspectors.
Okay. So your officers are on ground?
Our officers are on ground presently. Today, Friday, for example, is a day when you have butchers presenting animals for ante-mortem inspections especially.
Okay. Right.
So our officers have always been on ground, even during this, because again, food security is important. We have to feed our
So in light of this COVID situation,
in light of this situation, however, there are again specific guidelines. Slaughtering is occurring, but within a particular framework to ensure food safety and to ensure the safety of individuals and to limit the transmission spread of disease.
Okay, great.
So as Mr. Pierre mentioned, you have these guidelines. Our officers also have specific guidelines that they're working with. PPEs, protective wear, and so on we have to follow specific protocol and procedure to ensure safety.
Thank you very much. You're watching COVID-19 response of the Department of Agriculture and of course the Department of Health. We'll do for a second break. We'll be back soon.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join
Excessive agrochemical use, additives and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program UNDP.
the good food revolution.
Welcome back to the program. Let us go back a bit and look at your post-mortem inspections and all the activities as it pertains to your post-mortem activities.
Okay. Basically, for one to receive a post-mortem inspection, as Dr. Melville has outlined, we are carrying on from what she has done, more or less. First, before that ante-mortem inspection is done, the veterinary division would have to ensure that you have that permit from the police.
Right.
So once you can give that permit from the police, your ante-mortem would be done. For the post-mortem to be carried out, the environmental health officer would want the permit from the police and the ante-mortem certificate issued by the veterinary division. She did mention that that animal will be tagged. The documents given must correspond to the tags that are on the animal's head. At that point where we are doing the post-mortem inspection, that animal would have already been slaughtered, of course. So we are in fact inspecting the carcass of that animal. So that the tag that was affixed must remain on the air so that we can identify the animal with the documentation that was issued.
Okay.
A post-mortem inspection, more or less, you are systematically going through that carcass. You are looking at the lymphatic system, you are looking at the organ systems, and what the officer is basically doing is to look for any sign of disease within that animal, more or less, or anything that would render it unfit for human consumption. So the ante-mortem is important because there are diseases that may be spotted at ante-mortem inspection that you may not easily pick up at post-mortem. for example, if that animal was febrile, if it had a fever, it's not easy after death to see that it had a fever. Though there may be signs that an expert officer can look at and see that perhaps rigor mortis is not setting in properly and so on, that can indicate that it might have had a fever. But that's why both inspections are very, very, very important. Because we are lucky here in St. Lucia. We don't have a lot of the diseases we are seeing in the outside world, but we do have a lot of
more parasitic
diseases that you would find that would render a lot of times organs unfit and so on for consumption. But what we do see sometimes, and that is why the conditions that you are mentioning for slaughter, having proper slaughter houses, having proper facilities, a lot of meat is condemned not because it is diseased, but because of physiological conditions and not pathological condition. How it was slaughtered, if it was not stunned properly. Stunning is the act really when how you put it, have that animal unconscious and how you bleed that animal. All that is important for the quality of the meat, because sometimes you have people that just take maybe a big piece of wood and hit that animal onto the head and so on. And that sometimes we see some bulls that are being produced here in St. Lucia that are too heavy for the guys to handle, and there is a lot of what I will say wrestling with that animal, and the animal is all bruised up, and that affects the quality of the meat, because in those instances you would have poor bleeding, and sometimes you can have condemnation of the product as a result of this. The other condition sometimes we have to be mindful of is how quickly we are able to chill and to have those products refrigerated. A lot of our butchers have invested in small freezers and other facilities to enable them to hold meat products after it has been slaughtered. So that is the reason, which takes me to the next point on the guidelines that we have there. Why everything should be happening under sanitary conditions, because oftentimes, as I have mentioned, it is not pathological, but it's physiological. Poor handling of the meat, poor transportation, perhaps it was temperature abused, it stayed in the sun for too long, and that kind of thing, and can render, and there you have perhaps animals that you took a very long time to produce, and at that point where you are preparing for market, that you can lost that meat, and of course, and therefore it's not there, causing a food security issue. And that is why we need to continue to work with our butchers, and we are doing that to ensure that they understand those kind of principles, that things should be done under sanitary conditions, and to ensure minimal wastage of food in that process.
In light of COVID-19 now, the environment that we're in terms of the number of persons that should be at the slaughterhouse, and also the gear that they need to wear, could you give us some guidelines in that regard?
Yes, most of our slaughterhouses are very small, and that is more or less we have more slaughter slabs, so to speak, and they are all mostly operated by one or two, a butcher and a helper. In some instances 3 persons, which is not many. But what we are asking in terms of what we have outlined within those guidelines is that those persons are dressed properly, that they have they heighten the sanitary practices, that where we didn't have hand washing, now we're expecting, which is always a requirement under the slaughterhouse regulation anyway, we're expecting to see hand washing facilities, more frequent hand washing, providing hand sanitizers. The persons that are in there, they wear the mask as required, not necessarily for food safety reasons, but in the fight against COVID-19, We need to balance food safety. As Dr. Melville has mentioned, there are many plants in the US that have been closed as a result of not food safety reasons, COVID-19.
Correct.
So we need to ensure that those things are in fact in place. So they need to have measures for social distancing. As I have mentioned, not only they bearing that in mind, the butchers and the helpers as they go about their trade, but for the customers that are coming in to patronize and to purchase meat. We can no longer do that in a crowd. We need to queue, and in that queue they need to maintain the 6 feet distance. The persons that are coming to patronize must in fact, as has been outlined before, come into the butcher stall must wear their mask as well.
Correct.
And these are the things that have been put in place to ensure that we are functioning within that framework.
Okay. So Dr. Melville,
I just want to add quickly, because I have been asked that question, and we want to highlight, though, we want to make clear that COVID-19 is human to human, moves through human to human transmission.
Okay.
And so, because I've been asked whether the meat was the one of the meat.
Yes.
I have been asked that question. But it is not a foodborne illness.
That's right.
Transmission happens human to human. But again, you can have cross-contaminations, and we know that the virus can remain on formites or surfaces for even days. And so we want to limit, this is why all these guidelines are important. We want to limit the spread of the virus in these conditions. It's easy for sick persons who are, have been affected, to pass on and to shed contaminated surfaces.
Right.
So again, butchers, if you are ill, you should not be slaughtering. You should remain home, and that sort of thing. So that is what I want.
In terms of transportation of for example, the butcher, the meat from point A to point B, say from Mac to the Castries market, in light of the COVID-19, how is that being addressed?
Well, as Dr. Melville outlined, the food safety principles remain the same.
Okay.
Meat must be transported in a clean vehicle. It must be properly covered. It must be iced on the, to ensure that it is being kept chilled while it's being transported. So all of those things remain because the principles that guide food safety in the midst of COVID-19 remains the same. There has been no evidence that COVID-19 is transmitted through food. And when you are looking at products like meat as well, that would be heat treated. COVID-19, cooking anything will kill COVID-19. But what we are concerned, that's why we are saying that the good food safety principles as outlined within our regulations in the slaughter should be maintained. It should be heightened. And so we are actually trying to balance, as I indicated earlier. We are looking at 3 things here now. You are looking at food security, balancing food security, food safety, and mitigating the greater public health crisis which we now have, which is COVID-19. So all of that is amalgamated within the guidelines we have to ensure that things are done correctly.
Okay, great. Okay, I think we're due for another break. You're watching our response from the Ministry of Agriculture standpoint and of course the Ministry of Health. Stay tuned, we'll be back soon.
We at war with the virus, ready to harm us. Panic is not the answer. We can win this together. Often use hand sanitizer, better yet use soap and water. We must protect each other if we are to beat this corona. Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging around, no.
Advice is you to please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. us win this war. Say Lucia be a soldier, together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Welcome back. Dr. Melville, give us an idea of the set of guidelines you would like to give the farmers at this juncture.
Right. As it pertains to COVID-19, we want to reinforce the measures that we've been talking to our farmers about for years now. So we want to remind them of biosecurity on their farms. Now, you do not want any and everybody coming to your farm. Make sure you have proper biosecurity measures at your farm. And we saw what happened when we had a 24-hour lockdown. We had farmers who were left without feed for their animals, some of them, and we had to then assist them with permits so they could go get feed and so on. So farmers need to ensure that they have at least 2 weeks supply of feed for their animals, if possible, as much as possible. And of course, as Mr. Pierre mentioned, hand washing, regular hand washing, sanitation measures, proper hygiene and sanitation measures are key to limiting the spread. In addition to social distancing, sanitation hygiene is key to limiting the spread of COVID-19. But also, Mr. Sidney, as a veterinarian, it would be remiss of me not to speak to our furry friends, our four-legged friends, those of us who have pets, our dogs and cats. And what we're seeing now internationally is that some of our pets are being affected by COVID-19, by the virus, SARS-CoV-2, the virus that causes COVID-19 disease. We've had at least 2 dogs in Hong Kong who have tested positive for the virus. These animals were kept in quarantine with their owners. The owners tested positive for the virus, and these animals were tested and they were found to be positive for the virus. We've had, maybe some of you have heard, just recently, 2 cats in New York tested positive for the virus. And we've had several cases of tigers and lions in the Bronx Zoo that have tested positive for the virus. So what we've noticed now is that felids, or animal of the cat species, are affected by the virus. Dogs can get affected by the virus, but they were asymptomatic. They had no symptoms. However, the cats, especially these 2 cats who were in quarantine with their owners, and the owners tested positive, they had symptoms. So they were sneezing and coughing, the same symptoms that you would see. Respiratory, they had respiratory symptoms, the secretions from the eyes and so on. And so what had international regulations, OIE, the World Animal Health Organization, which is more or less a sister body to WHO, the CDC and other international standard setting bodies, have indicated that although the disease is human-to-human transmission and pets do not play a significant role in the transmission of the disease, we are asking pet owners to take the necessary precautions. Okay, we are still learning a lot about the disease. There's still a lot to be learned. There's still a lot of unknowns. So some of the guidelines that they have put in place is basic hygiene measures should always be implemented. Again, hand washing before and after handling or being around your animals. Avoid kissing. You know, some people love to kiss their pets.
Yes.
Avoid kissing, sharing food with their pets. You know, avoid these things as much as possible. When possible, if persons are sick with COVID-19, they should avoid close contact with their pets. Okay, as much as possible, or get somebody else in the family to take care of the pets. And if you must look after your pet and you are sick, you need to ensure, again, good hygiene practices, wear your face mask and so on. So there is, as we can see, things are changing, the dynamics is changing, and there's still a lot to be known. So we need to, again, take the necessary precautions, limit the spread of the disease. It is within our power to do so. The Ministry of Health has laid down the guidelines for us to follow, and if we follow those guidelines, we are sure, by the grace of God, we'll be able to beat this virus.
Thank you, Dr. Melville. Any final words from you?
I would just like to say thanks for having me on this program. Indeed, to be able to outline to the butchers and persons with intention of slaughtering what they need to do. We are in fact providing both services in ante-mortem, the veterinary division is doing, and we are in fact doing post-mortem inspection. So the butchers are not totally closed for business, so our officers are out doing that. but that must be done within a certain framework. So we ask persons who are interested in slaughtering to please contact the Environmental Health Division, and we can outline to them further what needs to be done.
Thank you very much, Ernie. And viewers, I would like to thank you for viewing the program. Of course, if you were watching, the Ministry of Agriculture or the Department of Agriculture and the Department of Health response to COVID-19. And I want to say thank you to Dr. Sharmaine Melville-Edwin for being here, which is officer in charge of the Vet and Livestock Services Division, and of course Ernie Pierre, who is the environmental officer, who is in charge of that section in the Department of Health. So I do thank you again for viewing, and people stay safe and eat fresh. St. Lucia's best. It's our opportunity now to consume what is being produced locally. It is healthy, and stay healthy. We will beat these things. Thank you very much.